Hi, and welcome to Hope with Answers. My name is Lysa Buonanno, and I'm really excited to be talking with Dr. Greg Riely today. We're going to get a little bit more in-depth about some questions we have about liquid biopsies. So can you tell us exactly what liquid biopsies are measuring?
Yeah, so the key thing about liquid biopsy is that looking for circulating tumor DNA in the bloodstream. So the circulating really means it's in the bloodstream. The tumor means it's from the tumor. And so the idea is that tumors, when they die, when little bits of the cells die, they break up and release that DNA from the tumor into the bloodstream. And then hopefully when we draw the blood sample for a liquid biopsy, we catch some of those samples. And then we take that and we spin away the regular white blood cells and we just look in the plasma and we try to find the tumor DNA. Now this is complicated because it's not just tumor DNA that's sitting there, it's also the DNA from the rest of the cells in your body. So we have to do a lot of sequencing to find the bits of DNA, and then we have to do a very fancy computer algorithms to subtract away the normal cells. And so you're left with just the tumor DNA. And based on all of that, we can hopefully identify the signal from the tumor that's in the blood. I say hopefully because there's always a risk, because some tumors just don't release any DNA into the bloodstream. Some people think that it's tumors that are only in the lung are less likely to, or the patients whose tumors are in the liver are more likely to, but there's just some that don't and some that do.
So this seems to be a fairly new test that's come out recently in the last few years, but there are several companies out there that have liquid biopsies. So is this something that is fairly reliable?
I think it's a real challenge because there are a lot of companies that offer plasma DNA testing or circulating tumor DNA testing or CF DNA testing, and many of them are regulated under a standard lab protocol called CLIA. Others are regulated by the FDA, but none of them have been shown to actually improve the care of patients, with potentially one exception, and that's the test that's used to identify EGFR T790M. That's in patients who have EGFR mutant lung cancer. When they progress on drugs like erlotinib, gefitinib, or afatinib, they sometimes have this T790M. And there is a plasma test that's FDA approved for that. I think that's not what people are usually getting out there in the real world. In the real world, the plasma DNA or the tumor liquid biopsies that are done are looking at all the genes. And the companies that have that, some are better than others, but there's no easy way to find out which is which. And I think oftentimes doctors make the decision about which to offer based on their experience with a particular provider.
Okay, great. Well, thank you so much for all this great explanation, and we look forward to sharing more videos with you with Hope with Answers.